Hi, I'm Dr. Stephen Greenberg, a board-certified and a RealSelf-verified plastic surgeon right here in New York. And this is how to tell if you're an ideal candidate for a facelift. We'll be looking at videos of real patients to see if they're candidates for a facelift procedure. And we will share what you need to know if you're interested in having a facelift. A facelift is a surgical procedure that helps rejuvenate both the face as well as the neck. We do that by lifting up both the skin and the deeper muscular layers of the face. Often we'll add different things to a facelift, like fat grafting, eyelid lifts, laser resurfacing, or whatever is necessary to give us the best possible cosmetic result. A facelift addresses both the upper and lower face at the same time. A misconception of a facelift is that it does not include the neck, but in my facelifts, I always include the neck, the mid-face, as well as the upper part of the face as well. But this is really individualized and determined by the patient's own anatomy. We really want that absolute natural result, but that involves us analyzing the patient and seeing what bothers them. I've been performing facelift for over 30 years and have done many different types of facelifts throughout my career. One of the types of facelifts that I do all the time is something called a mini facelift, where I make a smaller incision, a little less extensive work, and pull everything back up. But I also do something that's unique called a micro mini facelift, which is done under local anesthesia. I make just a small incision around the earlobe, put deeper stitches in, and pull back. I have patients who recover and go to work within 24 hours of having what I call the micro mini lift. A good candidate for a facelift is a patient who is unhappy with different aspects of their face, whether it's the neck and they have some laxity, or they have muscular bands that they like to take care of, or they're worried about the jowl or the mid-face. Those patients who are great candidates have that skin laxity. They have muscles that have separated or have fallen down over time, or they have loss of volume to their face. An ideal candidate in general is a patient of any age who has those anatomic problems that they're concerned about. Let's watch some videos of real patients who are interested in having a facelift.
Hi, I'm Alicia. I'm 60 years old and I'm from New York City. I think my biggest issues are my neck. And I feel like this is a way to tell how old someone is. You can see a lot of the lives I've lived here. I also think the jawline for me, and many women in particular, although I don't have a lot of excess skin where I feel like it needs to be pulled back, I don't like the way my jawline looks. I think it looks old, and it's just not straight the way it used to be. I think also my eyes, if there was a little bit of work we could do to sort of lift, pull back, whatever it is that you do there. I'm the believer of less is more. So I'd like to do as little as possible with great results. Now, when it comes to the subject of maintenance, how long do you really get out of a facelift? Thinking about recovery, how long is the recovery and how bad is it? Will there be bandages? Will there be bleeding? I really want to play by play.
So I think Alicia is an excellent candidate for a facelift procedure. Certainly a lot of her concerns are very common. She's most concerned about her neck. She has platysmal bands, which are the muscular bands in the neck, which we can easily take care of. She has jowls, which is the fat that was much higher in her face has now descended down. She also has some mid-face laxity and some brow ptosis or brow droopiness has come down over time. So if I were to address Alicia, I would say we can do a regular old facelift, which will involve a SMAS plication or a deeper muscular repair as well. We would make the incision around the ear, Alicia. We would gently pull back the mid-face, the jowls, and fix that neck up while fixing the muscles as well. A facelift is variable in terms of how long it lasts. Some people get 5, 10, 15 years or more out of it. But one of the things that I can tell you is a patient will always look better in their entire life if they have a facelift than if they never had it at all. The modern facelift is so different from the facelifts of the past because we involve deeper layers of the skin. We used to just lift up skin and be done with a facelift, but now we lift the deeper layers as well. The muscular layers give us very long-lasting results when we're talking about both the neck lift as well as a facelift. Recovery after a facelift is not what people think. It's really much simpler. I tell everyone, well, we can take a week off from work. You're not going to need much longer than that. And I've seen a lot of my patients recover in just a matter of 2, 3, or 4 days and put makeup on and go about their normal business. It depends how much work we do on the patient, how extensive their problems are, and how extensive our facelift is. The most common risks of a facelift procedure are usually scarring, which is minimal in most patients and tend to heal very nicely. Sometimes other complications include infection, very rare, bleeding, also rare, nerve injuries, or asymmetries to the face. We have to make sure that a patient is aware of these complications before any surgical procedure and alert their surgeon if anything goes awry.
Hello, my name is Donald Barre. I'm 53 years old and I live in Adelanto, California. The procedure I'm interested in having done is a facelift. I would like to know if a facelift would address the wrinkles in my forehead, and also I would like to know if the facelift will address the smile lines right here and the sagging skin. I would love to know if a facelift will help that, because I need to bring this up and remove this, and I'll be a happy camper. The questions that I would have for a doctor in a consultation scenario would be the difference in procedures as far as like, how would you do the surgery on a man as opposed to a woman? And since I don't have any hair, where would the scar lines be? I mean, would they be here, here, here? I would like to know exactly where you would put the marks. You know, I really want to know if I'm a good candidate for a facelift.
I think with this patient, it's important to understand what's bothering him. And what's bothering him are the wrinkles of the forehead, which is easily taken care of with a neuromodulator, with an injection, and you don't need a facelift to take care of that, or to fill up the laugh lines that he's most bothered about. And we can do a little liposuction in the neck. Often a facelift is not the right procedure, particularly in this patient who does not have a lot of hair to conceal a scar. There are several key differences in performing a facelift on a man versus a woman. We have to make sure that the scars obviously are well hidden, that we're not pulling up or making an unnatural look to the guys versus the women. A lot of times guys want very subtle changes where women want a more extensive facelift. So it's very important to look at the patient, speak to them, and maybe a facelift is not necessarily the procedure for them.
I'm Shelly. I live in the LA area and I'm 53 years old. And the procedure I'm looking to get is a full facelift. I'm looking to correct our, I feel like I have a lot of saggy skin. You can see it in right in here. I've got the kind of the sunken in under the eyes. My eyebrows and eyelids have kind of gone down as well. So I feel like just overall lifting of the saggy skin. I'm not sure if I would need like maybe additional procedures with the facelift for the eye area, or if that the facelift itself would like lift, I guess, the brow area enough. The questions I have are if I'm a candidate for a regular facelift versus a ponytail facelift.
In evaluating this patient, Shelly, there are a lot of things that we can correct, but I do agree with her in that she has lost some brow elevation. So I would do a brow lift on her where we gently pull this up. I would do an upper and lower eyelid lift, and I would do a regular facelift where we make an incision that starts up in the hair and goes behind the ear, and probably make an incision underneath in the chin area. She's also lost a lot of volume to her face, and in this type of patient, I like to add fat back into the face at the same time. So it's a combination of pulling the skin and the deeper muscular layers back, removing the extra skin in both the upper and lower eyelids to rejuvenate both of those, adding fat back in, and most likely in this patient doing a laser resurfacing to get rid of some of the fine lines and wrinkles. This is a full facelift patient along with an eyelid lift and a brow lift, and I think she would look wonderful with that procedure. There are a lot of different types of facelift, and a ponytail lift is really just a mini facelift with an incision up high without doing more extensive neck work as well. But I think in this particular patient, we really have to address the entire neck as well as the muscular bands down low in her face. I think the biggest benefits of a facelift is it not only makes the patient look better, but it makes them feel better and takes them back so many years. I see so many patients that are happy after a facelift come into my office and are smiling ear to ear because they look that much better. Are you interested in a facelift? Find out all you need to know on realself.com.